anchored by me. I know I would just do a little bit of introduction to everyone. My name is Itunu Jobifele, and I'm the training manager for SustyVibes, popularly called Joby, and aka Omologo 10G. Um, I want to use this opportunity to appreciate everyone that has been part of the community and joined us in this journey in terms of the Saucy Vibe training. I know that a lot of training have gone off within the year, and today happens to be the end of the month, let's say 2022. So we'll have more trainings to come coming 2023. But remember, our calendar year has not ended, so we're still in our calendar year as a community. But we want to say thank you to everyone. We know we've bored you a lot. We just had the training last week, and everyone has been fantastic. So thank you so much, everyone, for always showing up and not putting us to shame in the eyes of our facilitator. And that's a little bit that I would go in before I introduce our speaker for today. And also on behalf of SustyVibe, I would like to wish everyone a Merry Christmas and a fantastic New Year. If you're not a New Year resolutionist like myself, I know some people are not New Year resolutionist, but if you are, you would know that the year is coming to an end. A lot of things are going to happen. Change is gonna happen in your life. There's a lot of things happening in the world, but be rest assured, we are all in it together. The inflation is affecting everyone. I'm in Canada, interest rates is going up. So we are all in this together, and we've actually overcome the greatest of the greatest, which was COVID, and we would also overcome any challenges that we have. So please, each and every one of us, let's rely on each other to take energy and strength from each other. And then I would go into introducing our facilitator. Welcome again, everyone, and welcome Dr. Cassandra Akinde. Am I correct?
Yes, you are. Good evening.
All right. Thank you so much. Just for you to know, before I introduce amiable doctor, it's been a lot of back and forth between me and her, and she's been fantastic. So please, let's pay close attention to details, and let's also ensure that we have our notepad ready, because she's ready to diverge into the first aid treatment and how we are able to take care of ourselves. Remember, I said we are all in this together. So this is just, a sign of telling you that we've got you, we've had you, and we also consider that our well-being is actually very important. So I would go in so that I wouldn't talk too much. I think I've spoken too much already. I would introduce our doctor. So Dr. Cassandra is a public health specialist and an early career medical researcher. She has over 60 years plus experience in the field of public health, especially in the implementation of community-based projects and providing health policy-oriented solutions for the undeserved communities in Nigeria. She graduated from the University of Lagos College of Medicine in 2016 with a bachelor's in medicine and surgery, and just recently obtained a master's degree in tropical medicine and international health from the London School of Hygiene and Tropical Medicine, United Kingdom. Since 2018, she has served as a team lead of the Neo Child Initiative for Africa, an NGO that seeks to improve access to essential healthcare services and sustainable education among children in low resource settings in Nigeria. To this initiative, she and her team had reached out to over 15,000 Nigerian children with essential health services as nutritional assessment, malaria screening, immunization, health education, deworming, free medical and dental consultation, and provision of essential drugs. Our proven track record of health advocacy has earned her multiple humanitarian awards and recognitions, including Shevin Award Scholarship, sponsored by the Foreign and Commonwealth Development Office to further her studies in the UK. Be listed as one of the 100 most inspiring leader ladies Africa. Win Africa Volunteer Award in 2019. With LinkedIn Influencer Award for Health and Medicine 2020. British Council Future Leaders Connect Follow 2021 at Monlier Institute, University of Cambridge, and most recently emerged as the Future Awards Africa Prize winner for Health and Wellness 2022. Sorry. As aspiring global health leader, Dr. Akinde hopes to use health policy advocacy and research and innovation to address health inequality in Nigeria. So please, everyone, join me as we welcome our dear Dr. Akinde, MD, MSc, to take us on this journey of first aid treatment. Thank you, everyone.
Hi, good evening, everyone. Thank you so much, Itunu, for that great introduction. I'd just like to say a big thank you to you and to the SustyVibes founder and all the members of the team, for the invitation. I really appreciate the opportunity. And I'm really hoping that we're going to have a nice time together for the next, I think 50 minutes now, right? Okay, so forgive me, I will not be able to project my face as I had hoped. My network is having some issues. So, but let's just proceed. Maybe towards the end, I'll be able to at least show my face so that in case you see me, in Lagos, you'll be able to recognize me or anywhere in the world. Okay, so I think we can start.
Okay,
I just want to, yeah?
Sure, go on.
Okay, so I just want to also let the participants here know that once we start, this is going to be quite interactive. So the way I do things is that, I might just call on you if I have certain questions and just for everyone to be prepared, right? Of course, I would like you to volunteer, but if you don't volunteer, I will not call on you to respond to certain questions. So please don't be surprised.
All right, thanks so much, Dr. Just. I forgot this, and apologies for that. Just before you proceed, I would like to give a little bit of ground rule. Please, if we are not talking and we don't have any question, or she doesn't call out anyone to ask a question, please let's all mute our mic. If you have a question, please use the raise hand button on your Teams, on your Zoom, and then we'll be able to coordinate and answer your questions. So thank you, Doctor. You can proceed. Can you see my screen?
Yes, I can. Thank you very much.
Oh, you're welcome.
Okay. Okay, so the title of today's webinar is First Aid Treatment. I'm sure that we are not new to this, right? But it's just that I would like to take you a bit, to give you an overview, okay? Just a brief overview of what it entails, why it is important, well, what we need, okay? And just give you some specific examples. So if the outline, can you send the next slide, please? Can you please put up the next slide? Okay, thank you. So yeah, so that's the outline. So you can see that what we're going to talk about is the definition, okay? We're going to talk about the importance, right? So what are the reasons why this is important, okay? Then the first aid kit, we're going to talk about what it contains and why we all need to have it in our homes, in our workplaces, and even our schools. And then we're also going to look at some specific case injuries, and what are their first aid treatments. And then if there are any questions, we'll respond to that and then we'll conclude, okay? So before we start, I would like to find out if anyone here would like to say what they understand by first aid treatment. Is there anyone who wants to tell us, or should I call out people? First aid treatment, what do people understand by it? please. Seems our SustyVibes here are a bit shy.
We have someone raised up their hand,
Okay.
Anibate.
Okay. I didn't see. I can't see.
Okay,
No,
good
it's
Okay.
evening.
Okay.
Good evening,
Hi.
Dr.
Good
Kasi.
evening. Good
Good evening,
evening.
Netsunu. It's good to be here. So I think first aid definition, let me give the one we learned from primary school, is like the first treatment you get when there's an emergency or even one sustained an injury. So it's the first treatment you get before you finally get like the full treatment when you get to a hospital. Yeah.
Exactly. Thank you so much. Okay, so let's move to the next slide and let's give the proper definition, which you basically have already given. So here we said that first aid, refers to emergency or immediate care you should provide when a person is injured or is ill until full medical treatment can be available. Okay. And for minor conditions, first aid care may just be enough. You wouldn't even need to go further to the hospital. But for some serious conditions, first aid is just the beginning and it should not be continued until more advanced care can become available. Okay. And that's why first aid is so important for everyone to know. Okay. So next, okay, no, not the next slide yet. So no, can you take it back? Yeah. So what's the importance of first aid? So I want volunteers to tell me what are the reasons why you think first aid is important? What's the importance of first aid? Importance of first aid treatments. Anybody? Okay, Abraham, please. The floor is yours. And then afterwards, Ali Musa after Abraham, please. Thank you.
Yeah, good evening, everybody. Yeah, so one of the importance of first aid, which is the major importance, is just to save lives.
Okay, thank you very much. Mr. Alu.
Good evening, everyone.
Good evening.
Okay, please, first aid is important because it's a treatment one is given so before the arrival of a doctor or any medical personnel. So it's important because it can even save somebody's life before the arrival of the doctor. Thank you.
Thank you so much. Well done. I think you've basically said everything. Okay, Tobichuku Onyeka, please go ahead. Give us your importance. I mean, there's so many.
All right, I agree with Mr. Liu, and I see first aid as a stabilizing step before the real treatment comes in. So one of the key importance is to ensure that the damage done doesn't go beyond where it is. Wherever the damage is, it stops there until the real treatment comes to subsidize or take the next step. So it's like a stabilizing process of whatever damage has occurred.
Okay. Well done. Well done. I think you basically said everything. Are you sure I should continue talking again? It's like you guys know everything I'm about to say. Okay, so you can put the next slide, please. So if you look at the importance, I just mentioned three major ones, which already guys basically mentioned again, was to sustain or preserve life. So for example, mouth-to-mouth, respiration when breathing has stopped. That's just an example of that. Or to prevent worsening of a problem. Like for example, maybe somebody had a fracture of the bone, right? And you need to find a way to immobilize it before transferring to the hospital, right? Or last one is to promote healing and recovery, which is basically to reassure the patient, give enough pain relief and taken into the hospital. So those are just some of the importance. Okay, so let's go to the next slide. This I'll just talk about it a bit. So ideally, for first aid, we need to know like general directions, right? So a responsibility of a first aider in the management of any injury, right? What does it involve? Okay. So basically, as a first aid aider, what you're trying to do is to assess the situation, right? And you're trying to eliminate any possibility of potential danger. Okay. So after you've assessed the situation and you have eliminated, any possible danger, you would now like to identify the problem, right? So for example, maybe you notice that, okay, somebody got stabbed with a broken bottle, right? You want to make sure that there are no more broken bottles surrounding it, right? So you try to get rid of all those things as safely as possible. Okay. And then you want to identify the problem. And obviously the problem is that the victim is bleeding. Okay. So you've identified that. So after you've identified that problem, like, you are not going to, the next step is to provide help, right? And you also want to ensure that this person is conscious, right? As I said, help to determine the responsiveness of the injured or ill person. And the best way to do that, is to basically tap the person and, either say, are you okay? Or say the person's name, to know that the person is still conscious. Okay. And after you have determined the responsiveness and you know that, okay, this person is still conscious, or even if you're conscious, you yell for help or you call an ambulance. So we are living in this environment where we all know that, ambulance services are not so developed, as in some other countries. However, it's still important to, follow the procedures. And yeah, if, for example, you are at work, right? Hopefully you have, even if you're not just at work, even if you're at home, ideally in all these places, there's supposed to be a first aid box or first aid kit, right? I don't know if any of you at home or at work, you have your first aid kit. Does any of you have that?
Yeah, we do. At work, not at home.
Okay. So you have it at work, but ideally you can also get it at home, which is great. So you now look for the first aid box, and of course, it's important that you are familiar with the contents of your first aid box, because some people have it, but they're not even familiar with what it contains. And you should be able to identify, okay, in terms of bleeding, what are those things you need, right, to stop the bleeding, right? In terms of a cut, you know what you need, right? So the various possibilities and what you need. And of course, once that is done, you give immediate adequate treatment, and then transfer towards the hospital once you can do that. So the next slide, please. I understand that you said you have. Who is calling me? Hello, can you guys hear me?
Yes, I can.
Yes, we can hear you.
Hello?
Yes, we can hear you.
Okay, you can hear me. Perfect. Sorry, I thought you couldn't hear me. Okay. So I was saying that for the people who have first aid box, okay? For the people who have first aid box, what are those things you have in your first aid box? Let's just see if you are aware of what you have inside your first aid box. Maybe you can remove this slide so that people can just tell me from their minds rather than looking at this at this what's it called, slide. Okay, thanks. Okay, Abraham, you're saying something. Okay, Jennifer, you have spirit, cotton wool, and plaster. Yeah, for some places, that's what they think is first aid box, and that's not enough, because there are so many things that can happen. So, but that's why we are here, to get to understand what a real first aid box should look like and what it should contain. So, anyone else? Anyone? Seems nobody
Well,
wants to talk again. Okay, painkillers. Okay, thank you, Miriam. Painkillers, plaster, cotton wool, inhaler. I even have gloves. Well, that's good. At least that's something, you know? The one I'm very much familiar with is what Jennifer described, which is just a plaster, cotton wool, methylated spirit. That's all, you know? So that's the most common one I know, but let's see. Let's look at the slides and see. So the list you see here now, it's okay. You have not yet put the slide. Yeah, thank you. So the list here is not exhaustive, you know. I just put the ones that are most common, okay? However, you can still add more. Like for example, hand sanitizer is not here, but ideally that should be there. Okay, so here we have bandages, roller bandages, scissors and tape, you know, sterile gauze or a dry swab, right? We have antiseptic wipes and swabs. We have absorbent compress. So basically it's just lots of cotton wool. So triple antibiotic cream and pain relief medication, burns ointment, very important, you know, thermometer. In fact, it's interesting for me to know that, you know, lots of people don't even have thermometers, you know, at home. And that's something that is very, very important to have, you know. Mask for breathing, you know, if, for example, maybe you want to do a CPR for someone, I mean, you need to have that mask, then have non-latex gloves. We have oral antihistamines. Oh, thank you, Jennifer. At least you have a thermometer. That's great. Oral antihistamines, you know, 1% hydrocortisone cream, and that's for like allergies. You know, a lot of people have allergies, but they don't know that they're allergic to some things. And then when they do, I mean, they don't know. And by the time they start having reaction, you know, at least these are the drugs you can give. Then EpiPen, that's a very important one. That's basically adrenaline, okay, which is very, very important. And instant cold compressed back. So these are just some of them. Like I said, it's not exhaustive. You can still add more and more, like plaster, you know, but just that in this one we can use the bandages and the tape, right? So that's but all of them is important. Okay. So next, please. Next slide, please. So now I just want to discuss some particular case scenarios, right? Like I think the most common ones, I chose some that I thought, okay. Jennifer is asking a question. Is there a first aid for mental health issues? Well, that is for, you know, that's for like, you know, mental health experts, you know, and that's the reason why there's suicide healthcare lines and things like that are set up, so that, you know, if someone, you know, is feeling suicidal, you know, in some developed countries they have those type of facilities where if someone feels suicidal or feeling depressed or feeling anxious or any of that sort, they'll be able to talk to somebody. So for mental health issues, the first aid is mostly talking to people, you know. And of course, in certain cases, some physical, you know, restraint is necessary. Like for example, maybe you're at a place and then you see that somebody is about to jump from the bridge. I mean, at that point in time, is for you to, you know, hold the person, right, before he can actually jump, and then, you know, refer for treatment. But I think something like that deserves a training on its own, because mental health is such a wide topic, and it has so many conditions, right, that you would need to be able to really go through case by case scenario, right? Because I mean, one treatment is not enough for all. So that's what I would just say. Okay, so we're talking about cannabis. Yeah, I mean that's for treatment, but that's not first aid treatment for any of the conditions in mental health. So, but yeah, so let's talk about some case scenarios, right? Some particular cases, right? I'm sure that we all know what choking is, but is there anyone who is not familiar with choking, or what choking is rather? And here particularly we can see a very clear example of what the first aid treatment is. I mean, what the first aid treatment look like. Thank you, Abraham. A choke, yes, yes. So basically, what is choking? So choking occurs, okay, when okay, suddenly gets blocked, either partly or fully, okay, and that might be from some food particles or what have you. And so, of course, there are two types. There's mild choking and then there's severe choking. So mild choking usually happens when the airway is just blocked partly. So when you person, the person is still able to speak, okay, but it's going to cough a lot, okay. And for those type of people, is the idea is for you to encourage them to cough so they can cough out that particular particle that is blocking their airway. Okay, so that's basically what you do. Okay, that's for mild choking. Now, for people who have their airway fully blocked, okay, those are the ones that will now require either five back blows or 5 abdominal thrusts. Okay, the idea is that once they hit you on your shoulder blade, right, it will be able to bring out it will cause the pressure in the airway so that at least it will be able to remove whatever particle that has been lodged in it. With abdominal thrust, the mechanism is similar. I've attached a link. So I think later, when we finish this presentation, maybe we can look at the video, so that it can describe more of what I'm talking about. Okay. So this is just to give an example of choking, and at least I believe that if anybody is choking, like maybe you're in a restaurant and somebody is choking, that's not the time for you to just sit down and be looking at the person. That's the time for you to, quickly render help. Okay. So that's just one case scenario. So let's look at another case scenario. Yes, Jennifer. I mean, ideally, you would like to prevent it, but these things happen to it can happen to anyone actually, And for example, that is why they always say that you shouldn't be eating and talking at the same time, because majority of these accidents happen when you speak and you eat. Your mouth is full and you're still speaking. And as you're speaking, or maybe you're laughing, and as you're laughing, before you know it, instead of the food going to your food pipe, it goes into your air pipe. And then that's when you start choking and choking and choking. Do you understand? And hopefully you have someone right to help you, or you have to really try and, just cough it out yourself. But if it is very, very, full, it's going to, in fact, I think I've had cases where some people actually died from choking. So that's why it's something that has to be taken seriously. Okay, so the next case scenario I'm talking about is basically, I think this is like the most common thing that we all know. Okay, before I proceed, someone is asking a question. So someone is asking, after one has administered both 5 blows and the abdominal thrust, and the person doesn't recover, what do we do? Do we start to administer CPR? Well, usually that doesn't happen. But yeah, if what's it called, after you've done all the I mean, after you've done all that and it's still, yeah, you have to but CPR is, a very technical thing. So that alone too will require some particular training on CPR. Okay, because it's not just everyone who can do it. However, I do advise people to learn it, because everyone should know how to conduct CPR. Okay, because usually in those kind of cases, they'll not have to look for someone health affiliated, whether it's a nurse or a doctor or any kind of healthcare professional, right? But I'm always of the opinion CPR is something everyone should know. So very important. Yeah, very important too. So another question, how does CPR work if the airway is blocked? Isn't the blockage the reason for choking? Yes, it is, but there are ways you can go about it. Like I said, if you do a CPR training, we can demonstrate the whole technique. Okay, but let's just proceed with the case scenario. I think our time is very limited now. Okay, so scrapes and cuts, I think that's very common. That happens to us all, but it's also important for us to know what to do. So if, for example, you cut yourself and there is bleeding, right? What you need to do is to press firmly over the site with a clean cloth until the bleeding stops, usually between 5 to 15 minutes. And you can clean with lukewarm running water and pat dry. However, in this our environment, I would suggest we use either pure water or bottled water, because the running water we are talking about might not be clean, and it might even cause more infection than necessary. So it's best to use pure water or bottled water to clean the wound. Okay, and then after that you pat it dry. Now, if you notice that the skin is broken, right, that's where you now remember that in your first aid box that I mentioned, you're supposed to have a triple acting antibiotic ointment, right? And that's where it will now come. You will now be able to rub it, a amount of the ointment on the skin, and then cover it with a bandage or a gauze, and of course with the adhesive tape. If it is that you cannot control the bleeding after several attempts of this direct pressure that you've been applying, you definitely need to head to accident and emergency for professional treatment, because it's most likely that a blood vessel is affected, and that's why the bleeding is continuous. For example, if an artery was severed, right, something like that requires stitches, and no amount of, definitely you'll be able to suppress the bleeding a bit, but the bleeding will still, you will still notice that it is still bleeding and still bleeding. So that's why you need emergent care. But at least you have applied first aid, and then you now transfer to the hospital for proper treatment. And yeah, after that, you just continue to utilize your ointment, right? And you apply new bandage daily, okay, until the cut heals. Now, if you notice that if the wound, right, appears to be forming some kind of pus, or you notice that it's becoming swollen, it's tender and it's red, you definitely need to see a doctor as ASAP. And that's because most likely the wound has been infected, which is, quite sad, because when something gets infected, it's not great. It's quite painful and requires a lot of antibiotics. And in cases, it might even require, drainage, and that means incision and drainage. That means they'll use some instruments to cut the skin and then drain the pus. They'll have to press it firmly until they remove all the pus. In fact, I remember there was a case I saw, and this was actually quite funny. It was a case of a nail. Somebody would like to cut his nails with his mouth, with his teeth, okay? And that's how he used to cut his nails. And then I think at some point he cut it too deep. And then he just, I think he put methyl spirit or something. And then that little wound that he had became swollen. So by the time he presented to the clinic, there was so much pus in his nail bed. And of course, at that point in time, it had to be drained. And it was, of course, very painful for him. After that, he never did that again. So you see, sometimes when there are certain habits that you have, using your teeth to cut your nails and things like that, you have to be very, very careful not to cut certain parts before you end up with some infected hands, and then you have to undergo incision and drainage. It's a very painful procedure, let me tell you. Okay, so thank you, Tino. Please try. Don't do that. It's important. Always use the nail cutter. And even as you're using the nail cutter, also be careful not to touch your skin, to break your skin or any part of that. Okay, it's very, very important. Okay, so let's look at the next case scenario. I think, are there any questions? Okay. Yeah, next, yeah, burns. So this one is very important. Okay, let's see. I think Miriam is asking something. My colleague and infection. Yeah, you see? Yes, very important. You see, that's what I'm saying. This nail thing is quite interesting. And the antibiotics that she will have to take, very expensive sometimes. Yes, you said, okay, anybody's asking here. I've heard some folks say not to put bandages on scabs and small wounds. Only ointment, as this allows air to get in and heals fast. I mean, obviously, I'm not saying that if you have like a small cut, you should put a bandage, just a little bit of bandage, just, depends. If you put the triple antibiotic ointment, I mean, that's actually enough, depending on the size too. But if it is something like a deep cut, I mean, that will definitely require a bandage. Okay, it will definitely require a bandage. So, okay, so let's look at burns. I'm sure that some of us have had burns before, but it just depends on the extent of the burns. Okay, so if unfortunately any of us gets burnt, right? The first thing that we need to do, okay, is to immediately hold the affected part under a cold running water, or apply a cold wet towel, or apply our cold compressed pack that we have inside our first aid box that I mentioned before, until the pain subsides. Okay. Now, if the skin breaks, you need to apply antibiotic cream and burn ointment, which again is inside our first aid box. So you need to cover any blisters with a loose bandage or a gauze and a tape. You see, as a loose bandage, it's not something very tight that you want to make. So you need to also watch out, once you do that, you need to watch out for any redness, swelling, or discharge, as these are the signs of ongoing infection, okay? So now, sometimes this burns, like if unfortunately, maybe, God forbid, somebody had an accident, like a very serious accident where the whole house was on fire or something, and now you ended up burning your face, your hands, and God forbid, your genitals, or these burns you've gotten are even more than 1 inch of your body surface area. This is not the type that, you just place water and, no, this is the one that you have to head to the emergency room as soon as possible. Okay, because this particular burns, what causes issue with them is not even the infection that is so common with burns. What the issue here is the hypothermia. Okay, because majority of them, they lose lots of because of this particular burns, they will make you lose lots of heat at a very quick rate. It doesn't matter that you're in a hot climate. Okay, it doesn't matter the amount of heat you're going to lose, that body heat, though, not the external, but internal body heat you're going to lose because of burns. It can be a lot. And that's why something like that requires, even if, for example, maybe you have a blanket or something, a clean sheet, you need to quickly drape the person with it and take the person, call the ambulance and send them on their way to the hospital as soon as possible. Okay, or until the help arrives. So here I also mentioned that, if you have any blisters, do not pop them. Never pop any blisters. What you can do is just to put that ointment and that's all. But do not pop these blisters. Please, please, and please. Very important, because otherwise you cause a secondary kind of infection, which will even be much worse than just the primary infection. Okay, so that's for burns. Okay. Yeah, let's continue. Are people asking questions? If it happens to our imaginary enemy. Okay. Okay, so I put insect bites because I think some of us, we don't realize that some of us have some of us are allergic. Okay, and we have allergies. Some of these insect bites can cause very serious allergic reactions in us, and a severe allergic reaction can lead to anaphylaxis, and that can lead to death if care is not taken. So that's why it's important to take note of some of this insect bite that we have. You never know. Some of this, even black ants, ticks, especially some of us who have animals at home, especially dogs. Some of these dogs, they have so many ticks, and playing with your dog, some of those ticks get to you and they actually bite you. And before you know it, God forbid, you end up with Lyme disease or another tick-borne disease, which can be quite devastating. Okay, so first thing to take note, if for example you end up having a bite from an insect, right? There are some that have a stinger, right? And if you have the stinger, you should just gently scrape it with your fingernail, okay, to remove without breaking it, because if you use maybe like tweezers or something, it can actually cause the venom to even cause further injury. Okay, so you have to be very careful. Now, to combat the itching that comes from the insect bite, I know some of us have been bitten, and the pain after they bite you, oh my God, you can't imagine it, So of course you use painkillers, and then for the itching, you can apply the 1% hydrocortisone cream that we have in our first aid box. And in some cases, if the skin is broken, we can now take oral antihistamines that will help reduce the allergic reaction. Okay. Now, sometimes, like I said, you never know, and somebody might actually be allergic, to some of these insect bites or bee stings, and if that happens, sometimes how will you know that someone is allergic, or maybe you are allergic, is that the person might have, trouble breathing. Suddenly the person might start having trouble in breathing, you will notice that the face, your face. Okay, how do we measure the 1% hydrocortisone cream? That's how it comes. It comes as 1% hydrocortisone cream. Okay, so then you notice that the face will be swollen, your face, your eyes, your lips, your tongue. Okay, suddenly. So that's how you know that somebody is having an allergic reaction. And in that case, you need to do something about it. So which I will talk about in the anaphylaxis case scenario. But no, let's go back. I'm not yet finished my insects. I've not finished my insect bite yet. Yeah. So also take note that sometimes after the insect bite, some of us we get bites and we're like, oh, nothing, just an insect that bit us. But sometimes you might start experiencing certain symptoms after the insect bite, like maybe body weakness, vomiting, abdominal pain, lethargy. You notice that the part where the bite occurred is going to swell. Okay, so in those kind of cases, you need to definitely see the doctor, for further testing, because it can be some kind of tick-borne disease or a Lyme disease, so you need to follow up. So don't just think that is not important. It is. Okay. So now let's look at the anaphylactic shock. So I really want to focus on this because I know there are a lot of, people who are asthmatic, people who are allergic, and sometimes especially for some of us that don't know what allergies we have, right? You might eat something and that's when you realize that you're allergic, okay? And that, it's very common these days that you don't even realize that you're allergic to certain types of food. And when that happens, you just need to pray that somebody is there with the proper first aid box to be able to help you and administer the first aid that you may need before it gets worse. Okay. So what is anaphylaxis? Anaphylaxis is basically a severe allergic reaction. Okay, so are we still together? Let me know we are still together. Okay, we are together. I had ice cream one time and woke up with swollen tongue, I guess, and dropped down face. One side of my face dropped. It was scary. Oh, wow. But I don't think this is more like allergy to ice cream. Never really heard someone is allergic to ice cream, but then it's possible. Oh, okay, I see. I'm allergic to pepper soup. After eating, my face and my hand get swollen. Oh, wow. So you see, that means you cannot eat pepper soup, you know. It's unfortunate because pepper soup is very sweet, but you are allergic to it, so you are not able to take it. I don't take anything that is redly colored. Okay. Okay, yeah, so it's good for us to know what we are allergic to and what we are not allergic to. Do you understand? So it's important. But anyway, the fact is that it's an emergency, okay? And what happens, like I described before, is that a person who becomes allergic, it's something that is very quick, you know. All these symptoms happen just in seconds, you know. I don't know if any of you have watched this movie with Will Smith. Now, what was it again? Hey, I've forgotten the name. I wanted to say the name. But anyway, there's this movie where they showed Will Smith when he took something. I think he was allergic to peanuts and he didn't know, you know, and immediately his face was swollen. His tongue was swollen, his lips, his eyes, you know, he couldn't talk, right? He couldn't breathe, you know. And if care is not taken in those kind of instances, the next thing is for the person to, you know, to become dizzy and then collapse. So those are just some of the symptoms that people have, you know, when they're having anaphylactic shock. That means a severe allergic reaction to something that's to an allergen. Okay. So usually what that happens, the idea is to quickly lay the person flat, you know. So there's this thing we call EpiPen or Anapen. And basically what it is adrenaline injection. I think we should all know what adrenaline is, right? So this adrenaline injection, we basically insert it into the outer mid thigh. It's actually not difficult. If just unfortunately I didn't have the picture of an EpiPen, I will have shown you how an EpiPen looks like. So it's not difficult to maneuver. It's very quickly. You just insert it in your upper mid thigh, and that's that. Okay, it has saved lots of lives, and that is why it's very, very important first aid box material that has to be there. Okay, and then of course once you do that, you call an ambulance or call for help, you know. And while you are waiting, if you notice that there is no response, you still notice that maybe the person is getting worse, you can actually repeat, you know, the injection, but not more than twice, because you wouldn't want to increase the heart rate to that extent that, you know, there is no more. So, and then afterwards, of course, you will now transfer the person to the hospital. And of course, in the hospital, they will be observed further, you know, and given all the treatment that is required. Okay. But I just really want to focus on this anaphylaxis. And I'm glad that you guys are discussing about it amongst yourselves here, because you do know what you're allergic to, because unfortunately, some people do not know. And when they find out, like I said, they have that allergic reaction, and some people don't have access, you know, to not only first aid box, but to even, you know, healthcare facility, you know. So, you know, things are not looking good. So that's why it's important to know what you're allergic to. Okay. If there's any food allergy, any drug allergy too, because not just food allergy, you know, we are talking about, also drug allergy. You know, some people react, you know, to certain drugs, and if you know you react to those drugs, you better don't take those drugs, and be aware, so that when you go to any of your hospital appointments, you let them know right there, I don't react to, I have a strong drug reaction to this particular drug. Please do not give me this. Give me an alternative of this. Do you understand? Because if you yourself you don't know, how do you expect the doctors to know? Just like that, without you letting them know. So it's very important. Okay, so I think that's mostly for anaphylaxis. So let's continue. I see people have a lot of allergies here. Wow, that's good. I mean, it's good to have allergies, but it's good that you know what those allergies are. So fractures. Can your allergy be feelings? Medicine makes me annoyed. Please don't be annoyed with medicine, no, please. Oh. So, and yeah, you can still eat out. It's not an issue. It's just that you need to know what, like, for example, if you are allergic to crayfish, it means that if you are taking anything, just ask. I hope there's no crayfish. Like when you're looking at the menu, you need to look at what it contains. Okay. So for example, I'm allergic to blackberries. Okay, so I know that I can't take any if for example I'm taking yogurt or something, I can't take blackberries with them. I can't take any dessert that has to do with blackberries because I know I'll end up with an allergic reaction. So it's just important for you to know these things. Okay, so fractures. Okay, fractures, we all know what pinkberry. At the pinkberry, they usually have these blackberries that they add to the yogurt, and it's actually very, very nice. But unfortunately, I can't take it. Yeah, I mean, it's interesting. Some people have different allergies. Some people are even allergic to strawberries. Some people are allergic to apples. Some people are allergic to bananas. It's just that some people don't know that they're allergic to those things, and they only find out very late. So it's good for you to know. So maybe you need to try everything in this world for you to know what you are allergic to and what you are not. Okay, so fractures. Okay, you're allergic to cranberry. Wow. Fractures are broken bones, and usually they occur as a result of falls or any kind of heavy impact. So maybe you fell from a bike, you fell from a tree, or sometimes it's not even such. Sometimes you just fell in a very wrong way, and before you know it, you break your bones. So when this happens, the affected part should be immobilized. Okay. And of course, additional manipulation of the affected limb should be avoided. So basically what this slide is trying to say is that if you notice that, okay, this person fell and the person is crying that, oh my God, I cannot move my leg, I mean, just try to make sure that the person doesn't move that leg, and don't try to maneuver your way, because if you do, there might be some vessel there, or there might be some nerve there that you can actually further damage. So the idea is, I mean, definitely, I'm not suggesting that you get a POP in your first aid box, because that's not possible. But the idea, basically, if you can maybe find something like a clean cloth and just wrap it around the particular limb, and then quickly find a way to transport the patient to the nearest hospital, that would be perfect. Okay, but the idea is that particular affected limb should not be moving, because any movement can cause an injury, or can cause a further injury. Okay, so that's basically the idea. So that's for fractures. Okay. Yeah, so I think, did I put anything else in there? Okay, so next slide, please. Yeah, okay, I think Q&A. I think most people have already asked their questions, Although if you do have any more questions, you can put them in the chat, or you can actually maybe raise your hand, and then you can ask your question before we conclude. I think we are very good on time, aren't we now? Hey. Okay, so Jennifer is asking, I have an unpopular opinion about herbalists. I wonder how first aid was rendered before Western medicine. Well, you know what? I I guess I also have an unpopular opinion with you too, because though I'm a medical doctor, I do know that, there are certain herbs in the past, even currently too, that people still use and that actually have a very good medicinal value. Like for example, aloe vera, it's a very good plant for so many conditions, and especially if maybe you have a scar, if you put aloe vera, you'll be surprised how it will improve the healing, the skin healing. Like it will be almost the same way it looked before the wound. Okay, so I think that so there are certain herbs that actually do have very good medicinal properties, and for some I mean, I guess that's what they used in the past, but we are getting that. What first aid do you give to someone who loses consciousness? Well, that depends. So that's Itwa Miriam is asking that question, but that depends, Usually when someone loses consciousness, that's the one where you now have to do CPR, and like I said, that particular one, I wouldn't want to talk about it much because I believe that one requires a more deep discuss about it. Okay, because now unconsciousness can have so many causes, and at that point in time, you need to be able to do the ABC of resuscitation. So, okay, if someone is asking another question, yeah, the factors behind it, yeah, it might even be hypoglycemia, or it might even be an epileptic attack. So you need to be sure what it is, and it requires a lot of things. So that's why I don't want to, because if I have to start talking about it now, we are going to go through the whole thing, and it's going to take a while. If you watched Merlin, there was a king's herbalist that was using leaves for his medicine. Well, I guess, like I said, herbs can be great, but we have modern medicine now, so let's just use modern medicine. Any more questions? So okay, I think someone is asking something. Funny how most of our drugs have origin from plants. Of course, that is where most of the drugs are from, Most of them have medicinal properties. They extract those medicinal ingredients from them and then create the drugs. For allergies, I think it's good if folks use the health profile on their phone to save their blood group, allergies, and other health profiles, just in case they're unconscious and the medical personnel needs their profile. I agree with you completely. Also, it's good for you to know these things. Like, as I mentioned, like your food allergies, your drug allergies, your blood group, all these things, you have to have them handy. Yeah, you have to know them, because unfortunately, like I said, some people don't know these things. And unfortunately, that's what sometimes makes them lose their lives, just particular, if you had known that, oh, this person was allergic to this particular drug, could have saved someone's life, or this particular person was allergic to kiwi, could have saved someone's life, so that's very important. And yeah, for medical personnel to know their profile, definitely. For a person that loses sense of scent, what can one do? Okay, you mean like anosmia, like when the person cannot smell. Well, I mean, that's for I think that type of condition is to go and see an ENT and find what exactly is going on, because there are a lot of factors that can be causing that. Okay, so my advice would be go and see an ENT professional. There's ear, nose, and throat professional. What is this thing? I can't see my chat again. Okay, I've seen it now. I did pharmacognosy briefly, and they find this one amazing. I am telling you, pharmacognosy, pharmacology, I mean, anybody that is a pharmacologist, in fact, I always loved pharmacology, because the things you learn there about plants, about all these things, it's really amazing. And of course, even the vaccines as well, what you do now. Yeah, so let me see. I think we can continue with the conclusion, I think, and then I think that'll be that. Yes, thank you very much, Miriam, for asking all these great questions and contributing. I'm so happy that we had very, very active members here. You know, SustyVibes are very active, and I'm happy to know that. Okay, so I think basically the idea is here for the conclusion is that you know, first aid is not just for medical professionals. Okay, first aid needs to be known, it needs to be taught, you know, to everybody. Okay, and everybody should have an idea of what to do in certain, you know, general conditions. Okay, because you never know, you can actually be the savior of someone's life. Okay, just because you knew some of these little things. So that's why I do appreciate the fact that, you know, SustyVibes decided to even host this particular, you know, training, right? And actually give you like a brief overview what it entails. And of course, I'm sure that you still have more and more in-depth sessions on first aid, like the CPR training, the AED training, you know, and so many other things, because, you know, some of these things require practical demonstrations, you know, and you have to do these things in person, okay, physically, okay. And it's only that way that you'll be able to learn these things firsthand, you know, because I mean, all these things is theory, you know, I'm talking about. And of course, once you go and read certain things, it's also theory, okay. But once you practice these things, then you will now be able to know that, okay, you're an expert in providing first aid treatment, even if it is just for cuts, you know, even if it is just for fractures, you know, even if it is just for preventing choking incidents, you know, all these things are very, very important, okay. And yeah, so here in the conclusion, I mentioned that, you know, the need for first aid training is greater than ever because of the population growth throughout the world and due to increase of, you know, technological products, you know, electrical appliances, mechanical appliances that predispose us to so many accidents. Like even, for example, electrocution. I didn't even talk about that, but it's another, you know, there are things you need to know of how to provide first aid in those kind of instances, you know. And of course, more and more people are treating injury. So that's why there's a growing demand for first aid training, you know, for personal use and of course for workplaces and even schools. So I think this is a very good step. And I hope that, you know, we can continue training more and more people. And once you are trained, you can now continue training other people as well. You know, teach them what you've learned, okay? And the reason why these things are important. And before you know it, you'll just be saving lives. So well done, everyone. Thank you very much. Oh, he's blushing. Jennifer, you're blushing. You're welcome, Miriam. You're welcome. Okay, so thank you, Busayo. Okay, I think I have still one more slide. How to connect with me. Wanted to put it up there. Yeah, so this is my Instagram handle and then my Twitter in case anyone wants to follow me, you know. I would love to follow you back as well because I have really enjoyed speaking to all the 22 members of SustyVibes here. So yeah, thank you everyone.
All right, thank you so much, Doctor. Just to echo you, I mean, I have my CPR AED certificate in first aid. It's one of the things that you have to have if you're a member of the Health and Safety Committee in my organization. So I went to do it, and I remember that it was more of a physical training, and I was scared not to break is it my manicure or my dummy's chest. I didn't know where to actually put my hand. So the trainer said, "Oh, oh, oh, take it easy. You're gonna break the chest. So I think it's more just to echo what you said. It will be more effective and efficient if we have that in person. And once again, thank you so much for your time, and thank you everyone for also connecting and also following up with us. We hope to still stay tuned and have more trainings. And Doctor, we would extend thank you to you, and would also communicate with you via email for the communications, and hope that if we extend our hand to you, you'll be able to do the same in the future.
Yes, definitely. I would love to extend my hand and can follow up from there. Thank you very much.
All right, thanks so much once again, and don't want to waste too much of our time. What we give everyone to go enjoy their evening and enjoy the World Cup. And once again, Merry Christmas and a Happy New Year in advance.